Welcome to Untold Physio Stories, a podcast that informs and educates by connecting you to rehab industry leaders who share their candid successes and failures in business and practice.
This episode of Untold Physio Stories is sponsored by Edge Mobility System. Edge Mobility System is your online site for everything a PT, OT, DC, MT, ATC, or fitness pro would need. Get certified in blood flow restriction therapy or training online. Check out our full modern manual therapy seminars, ISTM toolkit, Edge suspension trainer, portable tables, and more. Untold Physio Stories listeners can save 10% by going to edgemobsys.com. That's edgemobsys.com/untold to save 10% off their first purchase.
Edge Health and Tech Solutions. We do websites that work for you and give you an edge over the competition. Did you know that you have less than 10 seconds to capture someone's interest in your website before they click away? How about the fact that most people are accessing your website from their phone? Save thousands and get a fully mobile, appealing, and SEO-optimized website linked to your social media, email list, and Google My Business. All for one low price and no monthly fees. Why not keep doing what you do best in your business and allow us to handle the tech side? Let's get started. Find us at edgehealthandtech.com.
Welcome back to Untold Physio Stories podcast. I'm one of your hosts, Dr. E, with Modern Manual Therapy, Edge Mobility System, and Modern Rehab Mastery. And my co-host is
Dr. Andrew Rothschild with Modern Patient Education.
How's it going today, Andrew?
Doing well, Erson. How are you?
Good. How'd the interview go? Oh, wait, no, that's tomorrow.
That's going to be tomorrow, yeah.
I guess you don't know how it's going to go.
I think it's going to go great.
All right, great. Yeah, of course. Well, for the interviewer, it will.
At least for me, it'll be fine. Exactly.
Yeah. Okay. So anyway, about 3 weeks ago, maybe 3 weeks ago, I saw a 12-year-old Olympic hopeful, from what her mother tells me, synchronized swimmer. And three weeks prior to this, she reported having hearing or feeling a loud pop somewhere in her right hip joint. And she had pretty severe pain that seemed to go away either within the practice or just a couple days of not really doing much. Then 3 weeks after that, she had the same kind of pop. This time she also describes like maybe feeling a tearing and severe pain. After that, she said that she told her coach, and her coach basically said, just continue either training or swimming through it. So she did that, and that was actually, I believe, maybe 5 or 6 days before she came to see me. She also had seen a chiropractor before that. I don't exactly know what he or she did. I assume that it's just adjustments, but she came presented with constant pain, 7 to 8 out of 10. She didn't really appear to be in constant pain when she was talking to me. She had antalgic gait when she walked in, but even sitting down, lying down, no matter what position she was in, she said her pain was constant. And I went over my whole spiel about, I think, constant pain as you can't even get busy and ignore it from the moment you wake up to the moment you go to bed. Every single second you're conscious, you always have it. And she said, yes, it's constant. But she was actually smiling, joking around with me. Didn't really seem like she was in a whole lot of pain. So I thought, she's 12. It's probably her lumbar spine if other people have addressed the hip. So I couldn't really do any like weight bearing screening, like flexion and standing or extension and standing. So I just started simply doing some lumbar loading. I checked her hip range of motion, of course, too. Hip range of motion, active and passive, was empty and feel painful in every single direction. Manual muscle test was painful pretty much with hip flexion, adduction, knee extension, and some hip external rotation. So she was complaining of pain mostly in like anterior and inguinal area. So it's kind of consistent with adductor or sartorius or something like that. Internal rotation, extension, really, it was weak, but it wasn't as painful. But every single direction I tried actively, passively is painful. I tried compressing, it was painful. I tried distraction, it was painful. I tried light isometrics, it was painful. I tried hard isometrics, it was painful. I tried lumbar loading, it was painful. I tried lumbar distraction, it was painful. Every single thing was painful and had no effect. I tried compression wrapping for modulation, it was painful. And um, the fact that it was constant pain worried me, right? And I know I talked to you about this actually. I think maybe even the day of or the day after I did it, and you also thought it was unusual, right? So what would you think? What would your differential diagnoses be? And then I'll tell you mine. And what you would tell the parent. Well, like, what would you tell the parent if you had that
Yeah.
as findings with no
She's had
relief,
no imaging done
no imaging done? Yeah.
and groin pain primarily.
Hmm.
I mean, my first,
Groin slash hip, but yeah.
yeah, my first concern would be like labrum.
Hmm.
With having an audible pop, having pain in that area, doing makes sense from the mechanism potentially for what she does and the movements that she goes through. Labrum would be on the list. You don't think stress fracture much with swimmers other than in the spine sometimes.
Hmm.
Um, but then the other, thinking constant pain and thinking like always with, you know, children, adolescents, I will always be more aware of like potential red flag things is, thinking some sort of like osteosarcoma, Ewing sarcoma type situation that I would want to make, if she's really having that much high level of pain, constant, not able to change it and modulate it very much, I would definitely want imaging to like at least rule it out.
Yeah. I thought also of a labral tear. Although for me, I just feel like because there's a rather high incidence in athletes that are asymptomatic. To me,
Right.
that
Yeah.
seems like a meniscal tear or a mild rotator cuff tear or any of those like kind of gray hairs on the inside kind of thing. And she's 12, and extremely lax, like so lax. I think like the first mechanism of injury she actually felt when she was stretching. And I told her mom that, it's very unlikely that she tore her labrum stretching because she is like so lax that, one of those people who could easily touch their thumb to their wrist, like their
Like
wrist is in the way.
like Ehlers-Danlos, or just like it's just some sort of just general hypermobility kind of
Yeah, I mean,
connective
I would
tissue
say
laxity.
general hyper hypermobility. I mean, I don't know the official kind of clinical diagnosis of EDS,
Yeah.
but someone would definitely diagnose her with like hypermobility syndrome if they tested her because I don't like that as a syndrome or even as that diagnosis. But yeah, she could easily palm the floor. Every single test I did, like the 9 out of 9 Brighton or Brighton, whatever it
The
is,
Biden
because
test, yeah.
yeah, if you Google it though, it's also Brighton.
Yeah. Okay.
So I'm not exactly sure which one that is, but I said that was unlikely. I told her mother also that I've seen a recent case or a case a couple years ago in another 12-year-old athlete who had constant pain, unable to weight bear. She could weight bear, but he was unable to weight bear. Like his mom had to carry him in and then carry him to like the ER afterward. He ended up having an infection, like
Mm.
a capsulitis, because he just had the flu or something. This is way before COVID. He had the flu and he had some sort of actual hip infection. So he responded to some sort of antibiotic or antiviral.
Yeah.
So I thought that that needs to be ruled out. And I also thought potentially a slip capital femoral epiphysis.
Yeah.
So I wanted all these things to be
Like
ruled
Calvin
out.
Firth's.
Yeah, yeah. Initially, she takes him to the ortho. They um, try corticosteroids. In the meantime, I also said, look, if this it really is some sort of muscle strain, it's also possible that, with her training schedule, she is just continuously irritating it and she doesn't really ever give it a chance to rest. I still think it's rare that it would be constant. And I don't know if she's exaggerating, but I mean, the constant pain is kind of the thing that worried me the most. And I kept on stressing that to her mom. I said, look, what's a training schedule like? And she said she trains 7 days a week. Some days are for 3 or 4 hours. And then she's also a multi-sport athlete. Like she also does lacrosse.
Oh wow.
So I said, "Look, are you sure she wants to do this?" She's like, "Oh yeah, she loves it." Like she just answered for her.
Yeah.
Um, because I've seen other kids where it didn't make sense and they were young, like very high-end athlete, and they were just totally burned out. And I remember one day after just doing rehab, and I even talked about this on a podcast a while back. Um, I asked the dad when the kid wasn't there, I was like, "Are you sure she wants to do this?" And she literally quit the next day after
Yeah.
talking with the coach because she didn't want to disappoint the coach. Um, and I asked her mother that in front of her, but then she said, "Oh yeah, she loved it. She loved it." So meanwhile, imaging showed that she had a labral. Well, I think they did an X-ray first, so that ruled out the subcapital femoral epiphysis. Eventually, she had an MRI done. They thought labral tear. After the MRI said no labral tear, then the PA basically comes back, who also said, "Oh yeah, I've never heard of that guy." When she showed him like my note.
Oh, great.
Yeah, yeah. I mean, whatever. I don't care. But anyway, I don't know if that was less credibility for me or whatever. The PA says, "Oh yeah, when I palpated her SI, it was very painful. So I think it's SI, and she needs some core strengthening." So when her mom told me that, I called her up and I said, "Look, I don't really think it's that." Um, he said also that the scour tests were positive. I said, "Literally, every single test I did was positive. Every test I I did, except for like some muscles were not positive, but every joint test was positive. That doesn't mean that she has all these things. It means that,
Or
again,
the
her hip."
majority are false positives.
Right, they're all either false positives or her hip is so inflamed from an infection or something else that she's really in that much pain. But I said, "Look, she really didn't appear to be an 8 out of 10 pain. I mean, are you sure she wants to do this?" She said, "Well, she did say that I don't want to go back to the doctor. I don't want to go back to PT, and I'm enjoying not swimming now." And her mom, said, "Well, hey, this is like $550 a month. Like, are you sure you'd want to do this?" And she's like, "Well, I'm just not enjoying not swimming." And I said, I had a long talk with her about just false positives, and said, "Well, maybe you should talk with like her friends and the coach, or maybe her friends know that she doesn't get along with the coach." And I also thought after I got off the phone, I remember her saying her coach made her swim despite the injury, and maybe she didn't like that.
I was going to bring that up, the fact that, like, yeah, that was definitely a flag for me as well. Like, that's, yeah, never count out coaches for doing those things.
For sure. Or, it could be like some kind of bully situation, or maybe she's
Yeah,
been doing this since, she was 5 or 6 or something,
this is
7 days a
burnt
week,
out.
and maybe she just doesn't want to do it anymore.
Yeah.
Yeah. So, I mean, that's as far as my updates go. And after, I apologize profusely because I said I don't think I actually gave you any more answers. I probably gave you more to think about, but I certainly don't want you to take her for core strengthening because she's an elite athlete. And core strengthening wouldn't help an SI anyway. And SI is like, I told her less than 10% because I know that's what the literature says. But for me, I feel like it's even less. And I think in a 12-year-old, it would be even less.
Yeah. And especially for, like, what would the mechanism of injury be?
And why would it be constant?
Yeah. And how would it have popped, like doing synchronized swimming?
Right, right.
Incredible stable environment
Yeah.
underwater.
I know. It's like the most open chain hip sport you could probably have,
Yeah.
like it's
I think
so
treading
open
water
chain.
takes a lot of core strength. She probably.
I know. That's what I said. I was like, your daughter's a synchronized swimmer. Like, she can do things that the majority of us cannot. I would drown if I tried those things. It's like core strength is not a problem. And I also said, look, I've also seen a doctor prescribe core strength to a world class power lifter, um, who literally can like deadlift 700 pounds or something like that. And this guy came to me. He was so upset that he was prescribed core strength. I'm like, it's just a generic prescription.
Yes, and SI joint pain is very also specific, like to the posterior aspect of the pelvis, not the groin.
Right, right. But apparently it was tender when he palpated there. I didn't think to palpate there because I just don't
Yeah.
palpate the SI, especially on a 12-year-old.
Yes, and it could just be tender because it sounds like everything around that area was just tender
Right.
at
Or
this
she
point.
probably sick of going to doctors, or she doesn't want to swim anymore. I don't really know what it is. I mean, I do think it's an interesting case. And I think, again, if it is constant, it worries me. But I think there's just too many yellow flags in the story. So we'll see though. Hopefully it's not anything
And I
serious.
think it does highlight something. Like I have seen it with teenagers. I saw a similar, not to the same degree, but I saw a similar situation when I was a student. I remember, and that was kind of the situation too, where the kid really didn't want to do the activity anymore. They don't necessarily have the, sort of the developmental or mature, to express it sometimes in certain ways. So sometimes just being in pain is the way to kind of avoid doing the activity anymore. And that's how they kind of express it. And it can be just as much as, it's not that you want to ever doubt the truthfulness of a kid, but they're also understanding they're still kids and they're still going to, things are going to present sometimes in different ways. And when things don't add up, it's a good thing to kind of at least consider.
Yeah, for sure. All right, Andrew, where can people find you?
People can find me at on Instagram and sometimes Twitter at a Rothschild PT, and of course, Modern Patient Education.
All right, have a good one.
You too.
Well, you can find me, Dr. E, at Modern Rehab Mastery. That's our new online mentoring program. It includes modern manual therapy, modern patient education, and modern strength training. It's 3 months with 3 mentors, so 1 month with each mentor, 4 weeks, tons of modules, lots of CEUs, learn at your own pace for a month, then move on. So go beyond the seminar. You also get chat room with your mentees and mentors and live Q&As every week. Check out all my products, Edge Mobility System. We have the new Edge ISTM toolbox that includes the Edge Mobility Star and the OG Edge Mobility tool, our Edge Restriction System BFR cuffs. That's part of Dr. Kyle Coffey's Modern Strength Training BFR certificate. I hope to see you at a live eclectic approach course soon. That's modern manual therapy in US, Canada, and South America. And make sure to rate Untold Physio Stories 5 stars on Apple Podcasts. You could also subscribe on Google Podcasts, Stitcher, and Spotify. And as always, you guys have an awesome day.